The information provided is for educational and informational purposes only. If you're experiencing pain and discomfort, please consult a qualified medical professional. Hello everybody, my name's Glenn and welcome to the Growth Lab podcast. Today's episode, number 1, we are talking all about knee replacements. Knee replacements for people perhaps just like you or someone you love, who want to be able to move and exercise and feel their best, but aren't really sure what to do after their surgery, or they've got their exercise, they know exactly what they should be doing, but now that they're 12 weeks post-op, what the heck do I do next? Well, we're going to answer that question and many more in this episode of the Growth Lab podcast. Let's start talking about joint health after a knee replacement. So, funny enough, I'm actually going to start with what happens before you get your knee replacement. That's right. And the reason I'm talking about before knee replacement is because what you do before you get your knee replaced is going to be almost as important as what you do after you get your knee replaced. See, one of the reasons why people have joints that need to be replaced to begin with is because of osteoarthritis. In fact, that's usually the primary reason people have a knee replacement. The cartilage between the two bones that make up the knee joint has worn down so much that there's now bone-on-bone contact and there's pain and discomfort. So why does pre-op exercise, why is it so important? Well, it's important for this reason. It's likely that the reason you have knee osteoarthritis is because your joints around your knee and above and below weren't strong enough and couldn't tolerate the amount of work you were asking them to do. And because of that, that cartilage wore out prematurely, and now you've got that bone-on-bone contact that causes you or someone that you love pain and discomfort. So one of the best things that you can actually do before your surgery is actually start getting your knee joints stronger. And there's a lot of different ways that you can do that. I do love machines like knee extension machines or knee flexion machines if you can. Isometrics like holding a knee extended position is a great way to go about it as well. The tricky thing about this particular aspect of exercise is that it's likely already causing you some kind of pain and discomfort in your knee. And there's the concern that doing more knee exercise may A, make it worse, or B, might just be painful to do. And so this is the most important thing I hope you take away from the pre-op exercise routine that you might consider doing before a knee surgery. And that's that any opportunity you can get to have your knee joint be stronger or the joints above and below the knee, like your hip and your ankle, the better off you're going to be recovering from your surgery. And this is because joints that have stronger muscles before surgery tend to have more support after the surgery. And it's that support after the surgery that allows you to recover quicker, feel better sooner with less pain and less discomfort. So the key here then is going to be figuring out which exercises feel good for you and doing those and avoiding the ones that are really quite uncomfortably painful. Now, there's a caveat here, which is you may be able to do some exercises that are a little bit painful that are tolerable, and that's going to be just fine because you're going to get that knee replaced. So that area that's bothering you isn't going to be bothering you nearly as much, if at all, after your knee surgery. So it's okay if you push through that pain just a little bit. Now, what I find for a lot of my clients that see me for knee replacements is that before surgery, they usually have a harder time extending their knee. So it really benefits them if they were to go to the gym and do some knee extension exercises to do both legs at the same time and choose a weight that's going to be lighter where they could do anywhere from 20, 25, 30 repetitions, heck, even up to 40 repetitions, as long as it doesn't cause the knee that's getting replaced too much pain or too much discomfort. The problem with doing 8 repetitions up to 15 repetitions is that load might be so heavy on your knee joint that it actually exacerbates those sensations and causes more pain and more discomfort than you may be comfortable tolerating at that time. So when you go out and start experimenting with exercising the knee joint, I would suggest choosing a very light weight that you can do a whole bunch of repetitions for and start fatiguing around 30 or so, rather than picking something that's too heavy where you get tired around 15. So if knee extension feels good, or if knee extension doesn't feel good and you need an alternative, a great other exercise you could do would be knee flexion. Now, don't get me wrong, you should probably train knee extension and knee flexion if you can, but if knee extension is too painful, doing a knee flexion exercise will be very beneficial. Knee flexion is when you bend your knee and you curl your heel closer to your rear end, to the sit bones of your hips. Now, knee flexion for some people still might be a little bit painful, but it tends to put a little bit less stress on the area that most people get pain and discomfort in. And so it gives them an opportunity to still train their knee joint, and the muscle that will support their knee joint, but with less pain and less discomfort. As a bonus tool or tip here, one of the things that I found works well for a lot of my clients, and you can try it on for yourself as well, would be to do the knee curl exercise on a machine, but instead of keeping your ankles in a neutral position, think about trying to pull your ankles all the way up towards your shins and then curl down at that knee joint. Doing things like changing the relative joint angle of your hips or your ankles when you're doing an exercise will influence the way that your knee does the exercise and can either cause less discomfort or more discomfort depending on who you are. For a lot of people, as I said already, pointing the toes up towards you as you do a knee curl could be really, really beneficial. Now, if you don't have a machine to do knee curl or knee extension, another great option is going to be isometrics. What are isometrics? Isometrics are when you hold the position, the muscles are contracting, they're working, but you're not moving anywhere. A great isometric exercise example would be something like the traditional plank, where people are resting on their elbows and forearms and their feet, and they're just staying in one area and they're not moving. The muscles are working of the trunk and the spine and the shoulders, but there's no actual movement happening. This is what's known as an isometric. And so for you, perhaps it'll be easier to do an isometric where you're sitting on your favorite chair and you're leaning back a little bit and you're extending your knee and you're holding at that locked out position. If this isn't something that you've done before or do very readily or easily, then this would be a really great place to start. You could also do the reverse for your knee curl, where you could be sitting in your favorite chair and think about pulling your heel backwards, either into the couch or just as far back as you can go, and holding that position and getting the joint stronger in that position. Now, as a caveat to all these exercises, isometrics and resistance training machines, if you are doing just body weight, eventually at some point you're going to run out of load or challenge. The great thing about machines are that we can customize them with the amount of load that we use. If a joint's getting stronger, we can add more resistance and continue to progress. If, however, we're just doing isometrics, you can't really progress the load as well unless you have some sort of external force that you can apply in the wake of a band, or perhaps adding an ankle weight to your ankle as you do knee extensions. Those are great options, but for a lot of people, they might not have those tools unless they want to go out and buy them. So I do recommend machines where you can, when you can, for some of these exercises. Now, as a bonus tip, when it comes to pre-op surgery, it's not just about the knee. It's also about the hip and the ankle. And this is something I do with all my clients whenever we're getting them ready for surgery. We actually train the joints around the one that's actually being operated on. And this is because your body has evolved and has been born with muscles that cross multiple joints. So to give you an example, your hamstring muscles, the ones that curl your heel towards your butt, 3 of those 4 muscles actually attach into the hip. So if you get your hip stronger and get those muscles stronger by doing a hip extension or some other exercise, you actually are supporting your knee joint directly. Same thing with things like calf raises or a calf raise machine. Because your gastrocnemius crosses your knee joint, but also crosses your ankle joint, if you get your ankle stronger, you will also get your knee stronger. All pretty cool things. So as a part of this toolkit pre-op surgery, here's a list of exercises I recommend. If you have machines and they feel comfortable, I do suggest doing a knee extension machine, a knee curling machine, hip abduction machine where you push your legs outwards, hip adduction machine where you're pushing your legs together. And I also recommend doing a calf raise machine if you can, and also doing a dorsiflexion machine, which is the opposite of calf raise, where you're pulling your feet up towards your shins. Doing these 6 machines and these 6 exercises can go a long way to helping your body prepare for surgery. This isn't an extensive list of exercises you could do, nor may all these be necessarily appropriate for you, but they are a very good starting spot. If you don't have access to machines, I do recommend doing these exercises. For your knee, do knee extension holds, do knee flexion holds. For your hip, you can go on your side and raise your leg up as high as you can if that feels comfortable. For your hips moving the other way, where you're adducting together, you can put a yoga block or a pillow in above your knees and try to squeeze your legs together. You can also still do calf raises, and there's another exercise called toe taps, which you can find on my YouTube page. It's really great to help train those ankle joints. So those are 6 exercises, both machines and also just with body weight, that you can do to help Your body gets stronger before surgery, so you can have a really fast, quick recovery after surgery. So congratulations, surgery is done. You are now in post-op. It's been a day, 2, 3 days after your knee surgery, and you have been sent home from the hospital. You should have been given a list of exercises that the hospital would like you to do, as well as a recommendation for a physiotherapist to help you do and learn those exercises over the coming weeks. The goals in this phase are to reduce swelling and inflammation, and also to start getting the knee joint stronger through an increased range of motion so you get more function back into your knee joint. Now, this is a very interesting time for your recovery, because even though you had your knee joint replaced and operated on, there are still some effects happening at your brain and the rest of your body. And this is namely that your brain is getting used to this new material inside of your knee joint. To your body, this is a completely new configuration. Even though you might not feel a huge difference in terms of where the joint replacement starts and ends, your body at a deep subconscious neurological level knows exactly where things have changed. And as a result of that, it will take time for your body to go through neuroplasticity, which is a reorganization of the brain state, in order to accommodate these new pieces into your everyday movement. So please, don't be discouraged if it can take some weeks or months to get used to your new knee. This is not uncommon. And depending on the time in life in which you had your knee replaced and the quality of the muscles and the other structures around your knee joint, some people take longer to recover than others, and that's okay. Now, immediately post-op, I leave the exercise delegation to the physiotherapist and the doctor. And the reason is because they have a very intimate understanding of how well your surgery went, and they are going to be the best people to prescribe the right exercises for you at this time. So please follow the recommendations that you've been given by your doctor and physiotherapist and do them diligently. If I can make one recommendation at this time, it's that consistency over time is what makes anyone successful in pretty much any endeavor. So at this stage of your recovery, please do your exercises every day and do them diligently. Even when you start feeling good, keep doing your exercises. Because as I just mentioned before, this isn't just about getting the range of motion back and decreasing the swelling. It's also about reintegrating this knee joint back into the rest of your movement. And these exercises they've given you at the hospital, these are good things to follow. So let's talk about exercise 4 weeks plus outside of surgery. So let's say we're now at the point where the surgeon has said, you know what, you're doing great. You can start challenging that knee a little bit more. And the physio has said, you're doing great. You can start challenging yourself with some other exercises. This might be anywhere from 4, 6, 8, maybe even up to 12 weeks after your initial surgery. What do we do next here? And how do we take care of this knee for the rest of our lives? First, let's set some parameters. If you stop exercising and you don't do anything after you get discharged from your surgeon, what's likely going to happen is your knee is not going to come back as strong as it was before. It's going to continue to atrophy. And if the muscles atrophy in your knee, you have less strength, less endurance, and less speed, which could mean that you start getting some pain discomfort in your knee or other joints later on in life. Or it could also mean that you just don't get to do all the stuff that you want to, which is why you got the knee replacement to begin with. Now, the other end of the spectrum is you're really gung-ho, you do too much too soon, and you blow past the tolerance of your knee joint. That might make it excessively sore or achy, or actually also cause you to start injuring your hip or ankle joints as those areas start to work a little bit harder to make up some of the load that your knee just can't handle. In either of these different scenarios, we're really looking for giving your joint the right amount of stimulus in order to keep progressing it so it gets stronger and stronger. And so you do more complex exercises that require more of your body. Because ultimately, if you can do hard things in the gym with your knee, it means the things that are going to be done outside the gym get easier and easier. Some simple parameters to think about once you start going back to the gym. 1, work through as full of a range of motion as you can under control. This means getting as close to knee extension as you can and get as close to knee flexion as you can every time you do an exercise. Please listen to your body, don't overdo it, but do try to challenge these areas. Because at the end of the day, it's not just about the actual strength and the quality of the muscle tissue, but also your brain's understanding of that strength and the quality of that tissue. If your brain sees your knee joint as strong, it'll allow you to use it in day-to-day life better and better. If your brain sees your knee joint as weak, it's going to shut down certain movements, you'll lose range of motion, and you won't have the quality of life that you're looking for. So try to challenge your knee joint through as much of a range of motion as you can comfortably. Now, the best place to start is going to be with single joint exercises. Going back to that knee extension, knee flexion, and that hip abduction, hip adduction machine, and also some calf work standing on that leg if you feel up to it at this point. That may be something that's too soon for you, so you might put that on the back burner for now. But doing a single joint exercise like a knee extension and knee flexion has some tremendous benefits. One, because you'll be sitting in a machine and you'll be using a light weight, you can actually really focus on what you need to do. Because there's less pieces moving in your body, like not having the hip and not having the ankle, you can really focus on what the knee joint is doing. This is a really powerful way to get that knee stronger. So I do like the knee extension and knee flexion machine for that reason. One of the best things that you can do would be to use a very, very light weight and start by doing both legs at a time. And the reason you're going to do both legs at a time to begin with is because this will help you use your stronger leg to take some of the work off of the leg that got replaced. And over time, as you start feeling more confident and stronger, you would start from going from both legs at a time to just working your right leg at one time. This will put more work and more load and more effort in that joint. And as long as it's recovered and it feels good and there's lots of integrity in that joint, this should not be a problem for you. Doing repetitions, around 30 to start with, and then week over week, starting to lower the repetitions down by 2 to 5 is going to be a great place to go and a great way to go about improving the way your knee gets stronger. So let's say you start going back to the gym, you've been cleared and doing the knee extension machine. Week 1 might look like doing a light weight for 30 repetitions. That's not super fatiguing on both your legs. Week 2, maybe increase the weight a little bit. You do 25. Week 3 to 20. Week number 4, maybe you get as low as 15, as long as it feels good. And then from there, you can lower the weight, half it down or a third it down, and then just do one leg at a time. So if you're doing both legs for 40 pounds for 20, maybe it looks like you do 15 and then see how it feels doing that one right-legged extension. And I would take this same idea and concept and apply it to knee flexion. Go into a seated knee flexion machine and do the exact same thing. Start with both legs and over time slowly increase the amount of load until you get to a lower weight. The most important thing here, and I can't stress this enough, is taking it slow. The exact repetitions and the exact load are not inconsequential, but they're less important than this. Challenging yourself a little bit through a controlled range of motion in a way that doesn't cause more injury and undue stress to your knee joints. That's it. Outside of that, you absolutely could do instead isometrics, but here's the thing. As I said for the pre-op section before, eventually with isometrics, you'll run out of the necessary load to challenge your muscle. You'll be able to hold that leg in the air for 40 seconds, 50 seconds, and then you won't be getting the challenge that you need. That's when you will be better off doing a machine. So I do definitely suggest doing machines. However, if you don't have machines available to you, those initial 6 exercises I mentioned, with the side lying hip raises, squeezing the yoga block, the knee extension hold, the knee flexion hold, and then the ankle toes up toe taps, and then also the standing plantar flexion. Those are also good exercises to do once you get cleared to do more exercise from your doctor and from your physiotherapist. Now, in addition to doing resistance training and strength exercises, there's also going to be very helpful for you to do some cardiovascular exercises. And you've got a couple great options out there for you. If your doctor hasn't recommended it or your physio hasn't recommended it either, one great thing you can start with would be walking inside of water. Water is great because it lowers our relative body weight, and as a result of that, puts less stress and pressure on our knee joint. So just getting used to walking in water in the shallow end of a pool will go a long, long way. When you feel comfortable, going for a swim with a floaty to support you if you need to, or not if you're okay. Going for a swim where you're doing front stroke or backstroke or whatever stroke feels good in a forward direction is going to also be very beneficial for your knee. One of the great things about water is that it's known as what's called accommodating resistance. Accommodating resistance in the sense that it's always going to move in and around you, and no matter what direction you kick your legs, you're always going to have some kind of resistance presented to your knee joint. So it makes it a really, really great way to train your knee, but also your hip and your ankle, your back, so on and so forth. And I can't recommend enough swimming for people who want to recover from any kind of joint replacement surgery, assuming that it feels comfortable for them at that time. In addition to this, something known as the recumbent bike is going to be very helpful for you as well. The beautiful thing about a recumbent bike where you're sitting and you're pedaling on it is that you can move the seat farther forward and farther backward depending on how much knee range of motion you have. If you have very little knee range of motion and it's painful, you can start the seat farther back, or if you feel really good, you can start the seat farther forward. Either way, what you can do is over time progress that seat to get further and farther forward, so that you require your joint of your knee to bend in greater and greater positions, challenging it and helping you maintain more range of motion and grow your range of motion, as well as work on your heart health, which is never a bad thing as well. Now let's look at 4 months post-operative and beyond. At this point in time, most people are going to be feeling pretty good in their knee joint, and they're going to feel more and more comfortable doing more and more harder, challenging things in life and putting themselves a little bit more in the gym. If you're there, great. This is amazing. If you're not there, that's okay. Keep working. You will get there over time. At this point in time, you can start doing more complicated exercises like leg presses and maybe even squats to help challenge your knee joint. Initially, when most people have surgery, that compression that goes through the knee doesn't feel too good. And so things like single leg presses or leg presses or squats don't tend to feel that great. However, as your body adjusts, there's less inflammation and it heals better and better. Your body feels more and more comfortable bending and putting some more of those compression forces in through the knee. And so you can start doing squatting exercise and leg pressing exercise to start challenging the whole musculature of the lower body more and more than you could do before. Just like with our recumbent bike exercise we talked about in previously a few seconds ago, one of the best things that you could do would be to start in a very small range of motion and then work your way up to a greater range of motion over time. Similarly, work with a smaller amount of resistance and load and slowly work up to more and more resistance over time. You can do the same thing with split squats or bodyweight squats as well. Now, if you're the kind of person who wants to return to exercise that might be more vigorous, like running, or perhaps there's skiing or something else that you're thinking of doing, there's another added piece here that you need to consider, and that is the velocity at which that knee joint can contract and support you so that your body can keep up with the demands of that exercise. Walking and even a light jog are slower exercises that usually take place in a very safe environment where you're not at risk of falling or hurting yourself. Things like skiing, tennis, sports, hiking even, they require large amounts of quick output from your knee joint and the rest of your body very quickly in sometimes uncertain scenarios. And in order for you to be able to tolerate that, you have to train that in the gym. And this is where doing easy jumping exercises comes into play, and even doing things like going up the Stairmaster at a bit of a quicker pace, or doing your other exercises like leg extension, leg curl, and leg press, but on a pneumatic piece of exercise equipment can also help as well. Ultimately, what I'm trying to say to you at this point is that if there's things that you want to use your body for that happen very, very quickly, and there's a little bit more inherent risk to it, you have to actually spend the time in the gym to work backwards and reverse engineer what you have to do in order to do that. If you want to be able to play tennis or pickleball, you have to get good at lateral movement. So you have to practice some of that at the gym. If you want to do things like skiing, where you have to rapidly absorb uneven terrain through your knee, hip, and your ankle and your back and the rest of your body as you go over different moguls or little bumps in the snow, your knee joint and the rest of your joints in your body have to be able to do that at that pace and in similar conditions. So when you're at the gym, this is the time to start training some of those fast things. Now, it's a bit beyond the scope of this podcast to talk exactly what those movements are, because those are very specific to the activities you want to do. So please do consult a professional. But the short of the long here is that, yes, you have to train those movements and make sure the quality of your joint tissue and the muscles as well can tolerate those things. Coming back to that Goldilocks zone example, if your body's not prepared for the activities you want to do, you do risk re-injury or you do risk hurting yourself in another different way. So please train your body for what it is that you want to do. So a few closing notes and thoughts from this podcast to help you move your knee and do it pain-free and have the quality of life that you're looking for. Number one, consistency over time is the most important thing. Do your exercise, stay consistent with it, build a schedule. That is how you get your knee stronger so you can feel good and do everything else in your life that you want to. Second, resistance training, especially with external load in a safe way, like with machines, is one of the best things you can do pre and post surgery to speed up recovery and give your body the structure and support it needs to do all the things in your life that you want to. Number three, don't move too fast and also be cautious about moving too slow. It's about giving your body the right amount of dose. And when you're thinking about how do I progress this, it'll always be better to start by doing things that are a little bit lighter for more repetitions and slowly move to heavier over time for less repetitions to see how your knee is going to respond to those activities. Number 4, don't forget about cardiovascular activities like the recumbent bike and being in the pool to help you with the recovery of your knee and to keep your heart health high as you recover from your knee surgery. And number 5, last but not least, if there are activities that you want to do like hiking or a sport that are inherently a little bit more risky, you have to train your body in the gym so that you have the ability to tolerate those forces in those activities. Don't miss this step. It's a really important one. It often goes ignored by a lot of people, end up hurting themselves later on. Everybody, my name's Glenn, and this has been another episode, I guess the first episode of the Growth Lab, all about exercise for pre and post knee replacement surgery. I hope it's been helpful. If you like it, please rate it. And if you think there's someone in your life that might benefit from it, please send it to them and subscribe for future episodes and content. Would love to have you hang around. Take care, everyone.